Hello everyone, my name is Akang Shrinani, and welcome to my YouTube channel NeuroChat with AG. On this channel, I plan to cover topics that are closest to my heart and support the neurodiverse community. Topics related to neurodiversity, autism spectrum disorder, and more. On the channel, I will interview thought leaders, esteemed researchers, scientists, professors, doctors, and psychologists, seeking their views and updates on their latest work, research, etc. I will also chat with parents of neurodiverse kids and adults and talk about experiences of neurodiverse individuals. If you are interested in watching more quality content on this topic, please hit the subscribe button and don't forget to press the bell icon to notify you whenever a new video is uploaded. Please also share the channel with your friends, family, and your social media platforms. Thank you. Today we'll be talking with Dr. ELINA Veytsman, Director of Clinical Services, Certified Peers Trainer. Dr. ELINA Veytsman is a licensed clinical psychologist and nationally certified school psychologist. She is an attending psychologist at the UCLA Peers Clinic and facilitates youth and parent social coaching groups across their preschool, adolescent, and young adult programs. The program has expanded to locations across the United States, has been translated into over a dozen languages, and is used in over 150 countries across the globe.
Dr. Veytsman, welcome, and thank you very much for the time today. To start, could you please tell us a bit more about evidence-based interventions?
Yes, of course. So evidence-based interventions are treatment programs or basically programs that have a lot of research to support their effectiveness. So for clinical research, when we're testing the effectiveness of a program like Peers, for example, the gold standard that would make something into an evidence-based intervention is an RCT, a randomized controlled trial. And so, for example, at Peers, for every program, before it gets published, before we have a manual, before we start training people on the program, we do 2 randomized controlled trials. So basically, you randomize people to receive the treatment or to be in a waitlist group where they're not currently receiving the treatment. And then you for us, it's a delayed treatment control group, so they do get the treatment later, but we're tracking how they're doing sort of before and after the program as compared to a group that did not receive that treatment. So we do 2 of those for every intervention that we publish to make sure that it's actually effective before we publish a manual. And if things aren't working, then we kind of change them and adapt things as we go along. So Peers is considered one of the only evidence-based interventions for social skills interventions for autistic teens and young adults.
Awesome, thank you. That sounds like a really good approach. I wonder why more people don't do that.
I'll tell you why. What it takes to be considered evidence-based is very rigorous, and it requires a lot of funding and a lot of time and a lot of personnel. And in autism, a lot of the funding, unfortunately, isn't going to interventions. I'd say there's more now, but a lot of the funding in autism is going towards genetics, or earlier on, it was like finding the cure, right? So it was more like biological or sort of basic research. And think about how much that costs, right? To do genetic research, like you need all of the technology for all of that, and that's millions of dollars. So most of the funding goes there just because it's so much more expensive. There is more funding now going into interventions. I would argue not enough. So it's really hard to get that funding. It's very competitive to get that funding, and particularly for older people, there's even less funding, right? Because a lot of the intervention research is for early intervention, and we know how crucial that is because we know early intervention makes all the difference in autism. But eventually those kids grow up and they become teens and young adults, and they need interventions too. But that's really why we don't see a lot of evidence-based interventions for teens and young adults, because it takes so much funding to do that.
Could you please talk about evidence-based tools for developing and maintaining friendships and relationships, and helping socially challenged teens and young adults? The Science of Making Friends, the book is, yeah.
Yeah. So I could spend days talking about that, which I do all the time. We train people all over the world on how to run our programs. So we have at Peers, we have certified providers in over 150 countries who implement our program, and they go through these 3-day training seminars with us where we teach them the ins and outs of how to run this program. So I could tell you, I could spend 3 days talking about this, but just to kind of sum up kind of how we do this and the format of how we do things. We have groups that we run for teens, for young adults. We also have them for preschoolers, where we teach what we call ecologically valid skills. And ecologically valid just means that it's not what we think works, it's what we know actually works from research. So based on sociology and anthropology research and focus groups that we've done with sort of socially savvy people, we came up, or Dr. Lageson really came up with a set of rules and steps and do's and don'ts of social etiquette. Because just because someone has good social skills, it does not mean that they know how to teach good social skills. It probably comes to a lot of us naturally, and we haven't really broken down what we're doing. And so we break down all these social skills that people are kind of naturally following into rules and steps and strategies, concrete rules and steps of social etiquette. And so the way that our groups work is we have a small group format. So about like 8 to 12 people per group, and they're practicing with each other. We have didactic instruction, meaning we actually have like a lesson that they're learning every single week for 16 weeks. All of our programs are 16 weeks. And that lesson includes those ecologically valid skills. It includes role play demonstrations of what to do and what not to do in different social situations so that they can actually see what it looks like. And with each role play, we're asking these perspective taking questions. So I'll show a role play, for example, of me barging into a conversation and ask the teens or the young adults, what did I do wrong there? And what was that like for the other person? What did they think of me when I did that? And are they going to want to talk to me again? And we can ask those same 3 questions for all of our videos to target their social thinking, their social cognition, because that's something that a lot of autistic individuals might struggle with. And then from there, they practice the skills. So it's not enough just for them to get lectured on it and see it. They have to practice it. And we give them feedback on their practice. And then they get homework assignments to practice these skills in the real world and generalize them into the natural environment. And then meanwhile, we're teaching their social coaches, who for teens, it's their parents typically. For young adults, it could be parents, could also be other family members or siblings, life coaches, peer mentors. We're teaching them how to best support the person who's going through the program and how to practice these skills with them at home, how to reinforce these skills in the real world, and really just kind of enhancing the generalizability of the program. That's why they're there. So those are sort of the evidence-based methods of how someone would teach social skills, right? You sort of break everything down into rules and steps, and then you have all these different components that come together. So that's how I would sum that up.
Could you please talk about the programs at Peers Clinic?
Yeah, absolutely. So the first program, sort of our flagship program, was developed in 2004. That's the Peers for Adolescents. That's for teens in middle school and high school, so typically ages 11 to 17. And we have a parent-assisted manual that we use for that. So basically, the teens are in one group, parents are in another group, and they're both kind of learning these skills at the same time. And then from there, the next one that was developed was the school-based program. So the school-based program is what it sounds like. It's run in schools. There's no parent component there because a lot of times school-based professionals don't have that same access to parents. So there's still parent handouts that they send out every week, but they're not actually running a parent group. And it's basically adapted for like a daily lesson format. So any teacher or special education teacher, school psychologist, speech language pathologist, any school-based professional could pick up a manual and run that program. There's also a young adult program. That one was developed a little bit later. It was published in 2014, and that's for people ages 18 to 38 or so. The research on that program is done 18 to 24, that age range, but in our clinical groups, we include up to age 38. It can even be used for older adults. I've used it in private practice working with an individual who was almost 60. So it's really just good social skills for any adult. In that program, they come in with social coaches. I would say it's about 70 or 80% parents, but some of them will come in with someone else, maybe someone around their age, but they might feel more comfortable, like talking about dating with, for example. And that's the big difference between the teen and young adult programs, is that the young adult program includes that dating component. So there's 4 weeks out of the 16 that are focused on dating. We don't include that in the teen program, but we do have an optional sort of add-on for teens that after they finish that 16-week program, we have a 5-week educational dating program only for alumni, basically. Because we always say you have to know how to be a good friend first before you can be a good romantic partner. And then we also have a preschool program. That's kind of a newer program. It's been around for a while, but the manual is just actually going to be published in the near future by the end of 2024. And we're going to start doing trainings for mental health professionals on that program in early 2025. But that's for kids ages 4 to 6. And instead of watching role play videos, they have a puppet show that we do every week. So we're acting out social skills with puppets, and then they have games where they practice those skills. And then their parents also learn how to best support them and also take videos of themselves practicing the skills at home with their children, and then bring them in each week and get feedback on their coaching that they're doing at home. And then at the end of each session, we have what's called parent coached play, where basically the parents and the kids are paired to have a play date with another parent-child duo, and the parents kind of coaching their kid while they're in the group having this play date, and we as the team are coaching the parent on their coaching. So it's this really cool kind of in vivo experience for the parents. So yeah, those are the 3 clinical programs that we have. We also have 2 new research programs. One is called Peers for Dating. It's a 16-week program that's just focused on finding and maintaining romantic relationships for adults. And then another one is Peers for Careers. And that one is basically teaching young adults who are transitioning from college into the workforce the soft skills for how to succeed in finding and maintaining employment. So things like networking and resume building and interviewing, understanding the workplace culture and navigating it, handling conflict in the workplace, things like that. So that's kind of an overview of our programs.
You could just talk about like who specifically the program caters to?
Yeah, so it was initially developed for people on the autism spectrum, but it's expanded a lot since then, and it's now used for people with really a range of social challenges. You don't have to have any diagnosis at all to be in our programs. It's really for anyone who is intrinsically motivated to learn these skills. That's probably the number one criteria, is that the person needs to be motivated to be there. We would never want to force social skills onto someone. It's always a choice whether or not you want to learn social skills and use them. If you think about it, we all make choices every day of whether or not to use social skills. You might have them, doesn't mean you always want to use them, right? So everyone who's in our program wants to be there. And other than the autistic population, I'd say the other most common groups that we see are people who have ADHD or who have social anxiety, depression, or just no diagnosis at all, just kind of struggling a little bit socially, because a lot of teens and young adults these days are struggling socially, and especially after the pandemic, there was a lot of isolation and there's a lot of loneliness. And so it's really meant for anyone who's struggling socially who wants to be there. And really the main priority needs to be social skills. So sometimes people will come in who kind of have more anxiety or depression, and that really is the forefront of their treatment priorities. And if that's the case, then this program probably wouldn't be the right fit, because we'd want them to first get help with those other mental health challenges before coming in for a social skills program, right? Imagine being really, really anxious or depressed. Like, you probably wouldn't want to use a lot of these skills, and it wouldn't be that helpful. And so, yeah, that's kind of the criteria.
How does going program help the people going through it, and what they do after? And do you have any specific experiences about that you'd like to share?
Yeah, definitely. So like I mentioned, for all of our programs, we collect a lot of data to actually make sure that it's working. And the type of data we collect is questionnaire data. So we ask the teens or the young adults and their parents sort of how they're doing with their social functioning before, and then how they're doing after the program. And even at follow-up, 1 to 5 years later, we followed up with families and asked sort of how they're doing. And we're assessing things like their overall social skills. These are based on gold standard measures of social skills that have been standardized to look at sort of the average for what might be expected for a certain age group. So things like social skills, social engagement, like how socially engaged they are, how many get-togethers they have with their friends, their loneliness, their friendship quality, their social anxiety, empathy. So a lot of different questionnaires like that. And most of them we didn't make up. They're just out there. They're standardized questionnaires. And also just social skills knowledge, did they actually learn the skills that they were supposed to learn? That one we did develop, because that measure is based on our program. It's kind of like a test of did they learn these skills. And so what we see is that after participating in the program, per both teen or young adult, so self-report and parent report, the participants are experiencing gains in social skills, in social responsiveness, decreases in loneliness, decreases in social anxiety, increases in social engagement. So, for example, in our teen program, they might go from having about one get-together a month to about 4 get-togethers a month, so about one a week, which is interesting because it's exactly what we recommend to them when they leave the program, that we suggest that they have at least one get together per week, and they're really following through on that recommendation. We also see that that's corroborated by third-party reports. So we've given questionnaires to their teachers before, and the teachers don't even know whether or not they're going through this program, right? And they also have seen these gains in their social skills. So those are the types of gains that we see sort of on paper. Anecdotally, I would say that the biggest thing that I hear after going through our program is increases in confidence. People just feel a lot more sure of themselves in social situations, and they feel like they have the steps, because we're basically decoding the social world for people, right? The social world is really confusing for a lot of people. And so we're kind of giving them information that helps decode it and make it more concrete. And so a lot of people just feel like they have the skills now to be able to go up to a group of people and join a conversation, or to develop a friendship or handle a conflict or handle teasing, those types of things. In terms of stories that I remember, there's so many. I mean, a lot of our teens and young adults, you see an increase in their independence, right? So like some teens, I've seen them 10 years ago when I first started here as a coordinator, and then they'll come back and do one of like our dating programs as a young adult, and I'll get to hear about them living in the dorms and like having roommates and being independent from their parents and going to a four-year university, those types of things I hear all the time. But I think one that really stands out was a teen that probably we saw him in 8th or 9th grade, and he really was struggling with loneliness and teasing and didn't really have any friends, and had really low self-esteem. And after going through our program, he really was building his confidence. He started finding his people. I think he started a club, like a gaming club at his high school, and started meeting people that had common interests with him, that were really accepting of him, and was already doing so well at the end of the program. And then a few years later, we heard from him and his mom, and we get emails like that all the time from people years down the line, just updating us on how they're doing. And it turned out that he was the valedictorian of his high school, and he gave this amazing speech as the valedictorian, where he talked about what it was like being a high school student on the autism spectrum, and got a standing ovation for the speech. And it was on YouTube, and he was like, you could tell he was so popular and he was so sure of himself, and it was like a totally different kid, a few years later. So we see stories like that all the time. It's awesome.
That's a really inspiring and nice story. Thank you for sharing that. Talked about people having to go off to college. There must be a lot of hesitation in taking these big steps.
Yeah.
So, and even in the smaller steps. So how do you comfort those parents and other people who are going through those situations?
Oh gosh, it's hard. It's hard for anyone, first of all. Like just that transition out of high school and into adulthood is a really tough transition, because you go from being a kid to an adult overnight. Like one day you're just in school and you have all this structure, and you're what you're supposed to be doing, and you have all this guidance, and then you go from that to you're out and you're on your own and you have to figure it out. And particularly for young adults on the autism spectrum, they experience what's called the service cliff after high school. So they have all these services through the educational system until they're 18, and then when they're or I guess 21 in California, because they can get transition services. But once they're exited from that, there's no more system that's overseeing their services, and it's completely up to the family to find support. And so because of that, we see a big kind of decrease in their well-being and just kind of poor outcomes for young adults, especially young adults on the autism spectrum. Because a lot of young adults with intellectual disabilities, they do have more services available to them. Whereas young adults that we see who are sort of high functioning, for lack of a better term, on the autism spectrum, the services just drop off, and there's very, very few supports out there for them in the community. And so parents are really the ones who are figuring out what to do and how to get them social support and how to get them independent living support and academic support. And a lot of colleges offer academic supports to people with disabilities, but don't necessarily offer any social supports. And what our young adults need is social supports. So it's very hard for them to find. So we're helping young adults become self-advocates, right? And being able to like express their needs in the workplace or in a college campus, to be able to talk to their professors and ask for accommodations and disclose a diagnosis when they need to. Like we have lessons on that in peers. And we're helping their parents support them from sort of behind the scenes. Because part of what we want is for our young adults to grow, to gain independence with doing these things for themselves and not have their parents doing it for them, right? That's not really going to work when you're in the workplace or in college. So parents are helping their young adults practice these things and prepare them for how to kind of advocate for themselves. But it's a tough balance for parents, right? Because they're trying to balance providing support and guidance to their young adult while also letting their young adult be independent and be autonomous. And that involves making mistakes and failing. And it's hard to see your child fail, right? But also, if you don't let them fail, they're never going to grow. And so a lot of what I do in the parent group is help validate what those parents are going through, and also normalize, failure as part of growth, as an important part of growth, and talking about how growth is not linear for anyone, right? There's going to be ups and downs. I would just say that the work that we do is it's very rewarding, and we get to see people's lives really change. And it's a short program. It's really only 16 weeks. And so it's not that much time in the big swing of things. And I'm really grateful that people let us into their lives, into something so personal for just that short amount of time. But really, we attribute a lot of the success of this program to the social coaches that are coming with these young adults. The young adults are, first of all, they're putting in a lot of work, right? They're not just showing up every week. They are working hard outside of the group. And it's not easy to do these things. Like for anyone, putting yourself out there and taking those risks of meeting new people is very hard. And so it's really inspiring to see just the motivation and the dedication that we see in our program, and also the support that we see. These social coaches, they show up every single week for their young adults or their teens, and they're supporting them, and it's not easy for them either. And so I just really appreciate all the families that we get to work with, and feel grateful that they let us into this one small part of their life journey.
Really, thank you for doing this, and hopefully over the summer I'll be at UCLA and volunteering at Peers and be part of this really uplifting and friendly community you've been talking about. Thank you.
That would be amazing, and we would love to have you. We consider ourselves one big family here at Peers, so we'd love to have you as a research assistant.